Some of you might be wondering, I'm a nursing student now and I'm also a registered nurse. How is that possible? Okay, so that's what I'm going to be explaining in this video. Hi guys, welcome back to the channel. My name is Princess Kelvin. If this is the first time of you seeing this beautiful face, you are so welcome. Thank you guys for always coming back to my channel and watching. I love you guys so much. So guys, today in this particular video I'm going to be telling you guys my nursing career process so far, because some of you might be wondering, I'm a nursing student now and I'm also a registered nurse. How is that possible? Okay, so that's what I'm going to be explaining in this video. So you guys stick around to watch the videos that you understand how nursing process goes. First of all, like if you're watching my former videos, I've mentioned a couple of times that studying BSc nursing, like the nursing degree that I'm studying for here in Nigeria, is 5-year course, a 5-year program. But then if you're only going to nursing school, that is to get RN, that is registered nurse, a 3-year program. So I'm studying for BSc nursing and I've spent 4 years so far. So the first year was just kind of like an introduction to nursing. Like we're having general course. In year one, we're not having practical at that period. We're just going for classes back to back, no practical at all. And if you know anything about nursing at all, you know that practical is key. Like if you know the book and you don't know the practical aspect, is really of no use, because you have to practicalize what you're learning. Okay, so then in year two was when we actually started our practicals. So yeah, right here in River State, we started our practical by going to University of Port Harcourt Teaching Hospital. If you guys have done a tour of it on EPTS, but if you guys have not seen that video, I'll put it in the link or somewhere around the video. So please click that video and watch, then come back to this video. So yeah, in that post, that was our first post. We were posted to different wards in University of Port Harcourt Teaching Hospital, and in that hospital there are different centers. There's pediatrics, there's surgery, there's obstetrics, different wards in that hospital. So we're posted to different aspects of the hospital. I worked in the pediatric unit, I worked in the surgical unit, and I worked in the medical unit also. So that was for year 2. Then when we went to year 3, then we were posted to, in year 2 holiday period, we were posted to Alu Maternity, a maternity health care center, where we just went to experience pregnant women giving birth and all. But then to me, I did not experience much then, because then I was still year 2. I was still kind of, let's say, getting used to the nursing program. It was not really that serious per se. So I'll be dropping some clips of some of the videos I made back then. So yeah, we went to Alu Maternity and we learned a little bit on delivery, pregnant women delivery, antenatal care, post-op and all. So after the break, the second semester break, we went to enter the year 3. Yeah, year 3, big girl at all. Okay, yeah. So year 3, we then started with our psychiatric posting. We started with classes first. Yes, we started with classes first. We're going for classes and all. Then after year 3, with the classes, we wrote our exam. Then year 3 holiday, we were posted for the psychiatric experience. So we're posted to a psychiatric hospital right here in Nigeria. So I'll also drop the link somewhere. So if you have not watched that video, you go and see how the psychiatric posting looks like. So there we learned a lot. That experience was really wonderful, because yes, we have this notion that mentally ill people are only people that we see on the road, or most people that we see on the road that are like physically mad, they are ill-dressed, they are looking tattered and all. That's not the case at all. Mentally ill people at times can be talking with you reasonably, but then there might be something wrong upstairs, or they might just be stressed out mentally and they just need someone to talk to. So sometimes they come into the hospital just to, like, say, take a break from life, if you understand what I mean. So that psychiatric posting was really wonderful. So you guys go and check out my video on psychiatric posting. Then after year 3, we entered year 4. Year 4 was is because I'm still year 4. Year 4 is the period that we are now. We are not really going for classes now because presently now in Nigeria we are having a break from school. Not a break actually, is a strike, ASU strike. So because I'm going to a federal university, we have not been going to school. But then we were posted to different words. So guys, I missed something. After our year 3, we're supposed to write our professional nursing board exam in year 3, like when we're in year 3. But due to some delays, COVID-19 and stuff, we were the exam was pushed forward a little bit. So we ended up writing that the nursing board exam after our year 3, when we were in year 4 first semester. So yeah, it was a general exam for everything I've taught you from year 1 to up to year 3 on nursing. We prepared so well for the exam. If you have not watched the video of me checking my results, check the link somewhere too. I will post it. And yeah, when I saw my result, I was so happy because the exam was a whole lot. That is the basic, like that's why you are going to nursing school, to pass that exam. If you pass that exam, you become a registered nurse. So guys, yeah, I passed the exam and that's how I'm a registered nurse and I'm still in school. You get the point. So yeah, year 4 first semester was where we wrote the exam and I passed and I'm a registered nurse. Then we are still in year 4 because of the strike and all. So now we are in year 4 and we were posted to different healthcare centers. Some of my classmates went to the other center and some went to the other, so I will not be too crowded at a particular center. So yeah, that's how we're going so far. So we still have year 4 to do and we still have internship to do. And this year 4 we are supposed to write our registered midwifery exam, which is going to be coming up soon, but I cannot really say the date right now because I'm not certain about the date. But the registered midwifery exam is going to be coming up soon. So if you watch some of my previous video, you remember when I say that in BSc nursing you get 4 certificates, right? Registered nurse, registered midwife, public health, and BSc nursing. So now we are at the point where we are going to write our registered midwifery exam. We still have our public health exam to write and then we will be done. So we are to write our registered midwifery exam coming up soon, but I cannot say the date like I said before. After that, in year 5, when we get to year 5, we will then write our public health exam. So but now we are still in year 4 and we are going gradually. Hopefully the process will go along smoothly as it has been so far. But one thing I have to say to anybody that is planning to study nursing or that is studying nursing is that the process of nursing is very expensive. Like you feel like if you're coming to university, that once you pay your school fees and you have the money to take yourself, like feeding your daily feed, that you'll be okay. But no, that's not the way it's nursing. It's probably from year 3 that you really start spending money because you have to pay for your exams. Your registered nursing exam is expensive. The indexing process, first of all, before the actual writing of the exam, those are money that you have to spend. Then you also write your midwifery exam, the indexing process, and then also the payment. And all this process you will still be paying for uniform and stuff. So the process is just expensive. Do not plan that when you're coming to nursing school that once you have paid your school fees that is all. That is not all. In nursing school you have to pay more things. There are still other things that you have to pay. So after public health exam, we are supposed to be going for our internship. That's how the process goes. You have to do your internship before you actually get your certificate, like the formal certificate handed to you. Not that you can't be working, you can be working. Okay, but then you know how the process is here. So yeah, that is basically how the process of my nursing career has been going. I hope the process will go along smoothly, and you guys, I'm going to be documenting the whole process for you so that I don't know, anybody that wants to go into nursing can watch my videos and understand really, because if I understood more, there are some mistakes or some things that I would have done differently, especially in my year 2 and year 3. There are some things that I would have done differently, but it's now that I'm really grabbing the concept or the process, how the process is going to, is flowing in this our nursing program. So guys, that is the process so far. That is how the process has been going, and that is what we are looking forward to doing. That is the year 5 part. We're still looking forward to that part. So if you have any questions at all, any question. Maybe you're having difficulty in one aspect of your registration, your indexing, please comment in the question in the comment section, and I will do well to reply you guys. Thank you guys for watching. See you guys in the next video. Bye.